And I remember the first week in hospital, which was fairly straightforward. I had a fever and wasn't feeling well. And then after that, there's a huge gap. And I remember 2 episodes or 2 moments. One was having a mask on and being in a special unit which had various people who had masks on and they were being treated with oxygen. And then I remember one moment when I'd clearly had some kind of a stroke, but it hadn't had any impact. And I remember talking to the doctor about it was strange that I'd had this stroke, but that I was fine, I'd recovered. Some of the problems is that I don't remember the problems. All I remember is that I've made progress. So I'm still not sure about using the telephone.
So when we came to assess him, this gentleman was found to have only mild to moderate word finding difficulties for low frequency words. So for example, pictures he struggled to name were things like a pyramid, a saxophone, things like that. What was quite striking is the degree to which he was able to mask or compensate for these expressive difficulties in functional communication situations. So we noticed that he was very easily able to substitute in synonyms or to spontaneously use strategies such as describing a word that he couldn't quite name. And he did so in a very confident, natural way, to the point that many of the ward staff and someone from the medical team as well were actually surprised to hear about his expressive impairment.
Give you the cues.
Yes, please.
A pet.
Cat.
A fruit. I can have a football that I have in my hand. Is it under the cup? Oh, yeah, okay.
Yeah.
A pear? I'm not sure.
That's okay, we'll come back to that one.
Yeah.
And his recovery is really very surprising. Can you tell us a little bit about that, given the size of his stroke?
Yeah, so there were a couple of features with this particular patient that really were very striking, that made him stand out, to do with his background mostly. So he speaks 6 languages altogether, fluently. He acquired these languages as an adult, so he had to learn them as part of his work as a foreign correspondent. He had a successful career as a journalist. He's lived in about 30 countries, I believe.
In March 2020, we described 6 cases of COVID-related stroke. Paul was the first of this series, a previously well gentleman with severe COVID illness, complicated by minor stroke, pulmonary embolus, DVT, and then recurrent major stroke despite full anticoagulation on day 11 of his admission. I wanted to investigate the lived patient experience and family impact of COVID-related stroke, and whilst it's similar to so many stroke survivors, it was unique for patients but also for clinicians. There were redefined roles, redeployment of staff, and the question of to what extent stroke services should even be active. To add to this, there was the unknown of the condition and what it could do, and whether it was at all even related to stroke. I hope this presentation gives a picture of what it was like for Paul.
Paul, it's so lovely to see you again. I thought it would be really nice to hear a little bit about your background first,
Sure.
before you even had the stroke.
Yeah. So I started out as a journalist, and in fact I then spent 20 years as a foreign correspondent for Reuters, most of the time in Latin America. So I had to pick up various languages. And then I came back and went into public relations for Oxfam, for Transport for London, in government, and finally for the University of Cambridge.
Can you talk to us a little bit about your recovery after the stroke?
Well, it was very strange to wake up having had strokes, and at first I wasn't aware of any deficit, of any problems whatsoever, and it took time for me to become aware and also to be affected by it and to feel what the problem was. And then it was a process of learning how to deal with these things, how to work on these things, not just physical. In a way, the physical, because I was fit, was easier because I knew what I had to do. It was more the mental stuff, trying to understand what deficits I had, what I couldn't do, and how I might get to improve those.
And do you remember what those tricky things were? I mean, I remember on the ward you were finding it difficult to send a text message, for example.
I'd been a journalist and a public relations expert, and suddenly I couldn't use my mobile phone. I didn't know how to use it. I'd been used to absorbing vast amounts of information, summarising it, detailing it. For example, I never took notes in meetings because I didn't need to take notes in meetings. And suddenly I was forgetting things. I couldn't remember things. Words in English were becoming confusing. And it was a period of sort of living in a bit of a fog, really.
So Paul, this is gorgeous to meet you in the flesh, as it were.
I can't tell you how much I owe you. Going from that period of not being aware what was going on, then going down, but having you there to just help me through it was priceless.
Only meeting online, I felt that we developed, and you with your other co-group members really developed a beautiful rapport. And also I believe that you're still meeting.
Yes.
Virtually.
Yes, we are.
Great. But I guess, the things that we also learned was that the difficulties of lockdown and people not being able to access the same resources, the same escape things that helps their well-being. And I think, what Ben and I have often reflected on is the well-being of the staff delivering this kind of intensive service.
Neurorehabilitation Online, or NROL, was set up as a response to the COVID crisis. We set up rapidly to start our groups in April, and we aimed to provide an online neurorehabilitation service which covered both talking therapies and physical therapies. We ended up treating a total of 86 patients across 23 London boroughs and 5 home counties. This demonstrated that a service could be mobilised very rapidly to provide online content.
So Paul, I think the thing that we learned together through Enroll was about, at the beginning of your story, when you came in, you were so delighted, ecstatic nearly to be alive and to have survived not just COVID but 2 strokes. And I guess what we went through in the talking therapy, so the cognitive rehab groups that we did and the emotional adjustment groups, is we kind of discovered and found together about the insight and awareness, which is a very common issue for people after stroke. And also that, what you described as looking the same, sounding the same, friends thinking that there was nothing different about you. But actually the things that were different, a lot of them were hidden, these hidden disabilities that we often find that are really distressing after having a stroke.
Yeah, perfect. A vehicle?
Car?
Yeah. Photography?
So life for many people after COVID has been challenging. There's been uncertainty about what the future holds. Can you tell us about your experience following discharge from rehabilitation as an inpatient? What's happened since?
I can understand that a lot of people have had a lot of problems, but it's been complicated. My employer doesn't really know how to handle it and doesn't really know what COVID, it's a university, it should, but it doesn't. It doesn't understand what this means. There have been conversations about, well, you just come back to work, and I think, well, I can't. Or what can't you do? Well, I'm not entirely sure, and I need to work this through. And so there's been a lack of understanding on the part of the people on the other side, and a lack of, to be honest, I've not had complete awareness of what I need to fix in order to move forward, and what can be changed so that I can move forward.
It's of course challenging to have been in hospital, but made even more difficult by not being able to see your family. Can you tell us a little bit about what that was like?
Yeah. Well, I think there's two things, and the first thing most people would think of, which is the lack of company support and emotional support from the family being there. I've always been with my family. When I was a foreign correspondent, they moved with me. I mean, we've always been together. And so not having them there was difficult. And given that I had problems working out how the mobile phone worked, I couldn't even talk to them as much as I had done before. They worked tremendously together to help each other, but it was difficult. And the other issue is the emotional issue. As I said, when you don't actually see a change happening, and therefore you go from one thing to another thing, I think for the family it was very difficult to understand that.
Now, of course, Paul's home. He's almost back to normal in many, many ways. But of course there are changes, and there are issues that we as a family are working on together to get through this.
What do you think the future holds for you?
Well, it's strange because it's totally changed the way I think of things. One of the things it's changed is what's important. And family was always important, but it's so much more important now. Spending time with the family, being with the family, being with grandchildren I've got. And the second thing is, again, it's interesting because I was going to do some public relations and go and work freelance. And what I want to do now is to tell people about what they need to do to recover from stroke, what they need to do to work with yourself and with people like yourself, and how we can help more research, more work together.
Paul was previously fit and healthy in every sense, and in that moment in March, life changed dramatically. And reflecting on his story, it highlights how crucial all aspects of the stroke pathway are, from the London Ambulance Service through to community rehabilitation and now virtual services. I'm sure at the conference we'll hear about the great strides and innovations that have been made nationally, and we're undoubtedly in a better position than we were in March. Our knowledge of this condition is far better, with excellent studies including Setikos that have highlighted the link between COVID-19 and ischemic stroke. But it absolutely strengthens the argument for preservation of all aspects of the stroke pathway, particularly in light of winter pressures and a potential second wave. For me though, reflecting on Paul's story, the message is certainly one of hope, hard work, coordinated services and incredible innovation.